Hi friends, today I am going to discuss about the criteria for diagnosing SLE. SLE is systemic lupus erythematosus, which is an autoimmune condition. And there are many criteria for diagnosing SLE. This is one of the standard criteria. This is called as Systemic Lupus International Collaborating Clinic Criteria for Classification of Systemic Lupus Erythematosus. It is mainly divided into two main groups. One is clinical manifestations and is immunological manifestations. First, we will discuss about clinical manifestations. From going superficial to deep, first consider skin. In skin, there will be acute or chronic changes. In acute cutaneous lupus erythematosus, the patient will be photosensitive, will have malar or butterfly rash, or the rash may be maculopapular rashes, and bullous lesions may present. In chronic, discoid lupus erythematosus is seen, whereas panniculitis and lichen planus-like lesions may be seen. This is one criteria in clinical, and the second one is oral or nasal ulcers. The patient may have oral or nasal ulcers, and the alopecia will be there, and it is of a non-scarring type, and synovitis, that is arthritis, will be there, and more than or equal to two joints involvement is must. Serositis like pleuritis causing pleural effusion and pericarditis, it is one of the clinical criteria. Coming to renal, there is one thing called a protein creatinine ratio, through which we can know the degree of renal impairment or renal dysfunction. If it is more than or equal to 0.5, it can be considered as one of the criteria, and if the patient urine has RBC cast, it will be one of the criteria. And coming to neurological, seizures, psychosis, mononeuritis, myelitis, neuropathies, and or acute confusional state can be considered as one criteria. Coming to hematological manifestations, the patient may have hemolytic anemia or leukopenia, that is a total WBC count less than 4,000, and lymphopenia, total lymphocyte count is less than 1,000, and thrombocytopenia, the platelet count will be less than 1 lakh. All these are clinical manifestations. Coming to immunological manifestations, ANA means anti-nuclear antibodies may be positive, anti-dsDNA will be positive, or anti-Smith, at least it will be positive, anti-phospholipid antibodies will be positive, and low serum complement levels, C3, C4 levels will be low. And in the absence of hemolytic anemia, positive direct Coombs test will be considered as one of the criteria to diagnose SLE. So at least one in each category, that is, at least one should be there in each category, and any four criteria including at least one in each category, we can classify this patient as a patient of SLE. And this criteria has a specificity of 93% and a sensitivity of 92%. This is all about diagnosing or classification criteria for SLE. Yeah. Thanks for watching video.